Hi, Mama. Welcome back. I'm Dr. Emily, physician, mom, and your guide through all the wonders and worries of pregnancy. And before we dive into today's important topic, I want to remind you to check the description below where I've linked a curated list of pregnancy-safe and baby-approved products that I truly trust. These can help make this journey smoother, especially as you prepare for those first precious days with your newborn. Now let's talk about something that can sound really scary when you first hear it. The idea that your baby might drink or swallow dirty water while still in the womb. What does that even mean? Is it dangerous? And what should you do if this happens? So here's the real story. That dirty water usually refers to amniotic fluid that's been stained with something called meconium, your baby's very first stool. Normally, babies pass meconium after birth, but sometimes they pass it before delivery, and that early release mixes with the amniotic fluid. That's when we say the fluid is meconium-stained. There are a few reasons why this happens. One of the most common is that the baby might be a little stressed, either because they're overdue, there's been a long labor, or sometimes no clear reason at all. It's also more common in pregnancies that go beyond 40 weeks, and in many cases, meconium in the fluid doesn't cause any harm. But in some cases, if the baby inhales that fluid during labor or delivery, they can develop what's called Meconium Aspiration Syndrome. That's when the particles of meconium get into the baby's lungs and cause breathing difficulties. It sounds frightening, and it's something doctors take seriously. But here's the good news. It's not that common, and when it does happen, hospitals are ready. We're trained to act quickly and clear the baby's airways and provide support. Now you might be wondering, what can I do about it? And the first thing I want to say is, take a breath. This is not something you caused. It's not something you can always prevent. But what you can do is keep going to all your prenatal appointments, monitor your baby's movements closely, and tell your healthcare provider if anything ever feels off. If you go into labor and your water breaks and it looks greenish or brownish, definitely let your provider know right away. That could be a sign of meconium. Your birth team will then monitor your baby carefully during labor and be prepared to intervene if needed. And again, in most cases, everything turns out just fine. The most important thing is to stay informed, stay calm, and stay connected to your care team. The final weeks of pregnancy can feel long, and sometimes the information you hear is overwhelming. But you're doing great, and just asking these questions shows how much you care about your baby's health and well-being. If you've ever experienced meconium-stained fluid or just have more questions about what happens before and during delivery, drop a comment below. I'd love to hear your thoughts or help where I can. And don't forget, check the links in the description for baby essentials I recommend as a mom and doctor. They're there to make this journey just a little bit easier. You've got this, Mama. I'll see you in the next video.